Decoding Diseases, the Power of Genomic Data in Early Detection. Good afternoon, everyone, and welcome to the Abdos LabTalks series, where we aim to bring the meaningful conversation from the world of life sciences to the people who live it every day. I'm your host, Dr. Purnima Sharma, and today we are diving into one of the most transformative shifts in healthcare, that is, how this genomic data is helping us to detect the diseases not just early but sometime even before they begin. From cancer and heart diseases to the rare genetic disorders, the ability to read our DNA is unlocking the insights that were unthinkable a decade ago. Joining us today is someone at the forefront of this revolution, a clinical geneticist in the field of preventive precision medicine, an experienced medical scientist specialized in molecular genetics and the genomic diagnostics with an over 15 years of expertise. Her work have significantly contributed to the genotype-phenotype correlations, molecular diagnostics, and the genetic disorders. She has been honored with the prestigious accolades including the Women's Scientist Award, DBT BioCare. Please welcome Dr. Saima to the show.
Thank you, Dr. Purnima. It's great to be here.
Thank you, ma'am. So let's dive right in. We keep hearing about the genomics as a future of medicine, but how exactly is it changing the early detection of diseases? Can you please enlighten us on that?
Yeah, that's a great place to start. Now, genomics is fundamentally shifting healthcare from reactive to predictive. Traditionally, we have relied on symptoms to detect disease, by which time the condition may already be advanced. Now, by analyzing a person's genetic code, we can identify risk before any clinical signs appear. Rather than waiting for symptoms to appear, we are now able to predict risk, flag disease pathways, and intervene early, sometimes years before a diagnosis would traditionally be made. So it's proactive, personalized, and preventive medicine in action.
So, can you give us some example what you just mentioned? Maybe something from your clinical work?
Certainly. So very recently, a case really underscores the power of this approach. A 42-year-old male patient came in for preventive screening. No family history, no symptoms, just a proactive interest in health. We conducted a panel that is screened for hereditary cardiovascular risks. He was found to carry a pathogenic variant in the MYH7 gene, which is associated with hypertrophic cardiomyopathy, a condition that often goes undetected until sudden cardiac events occur, sometimes in young athletes. We confirmed the diagnosis with cardiac imaging, and he was started on beta blockers, advised on lifestyle modifications, and we even did cascade testing in his family. And to our surprise, identifying two relatives who were also at risk. That one genomic test potentially saved 3 lives. That's the kind of impact we are seeing.
So basically, it's like from lab to the real life impact, and even in those conditions where the person is not prior having any medical condition, he was just on a basic health checkups. So incredible. Going ahead, as we are in 2025, what would be the latest trends which you think are the more exciting in this particular space?
Definitely, there are many, but three big ones are: the first one is whole genome sequencing in primary care. Some hospitals are now sequencing patients as early as birth. Then polygenic risk scores. These look at hundreds of genes at once to predict complex conditions like diabetes, cardiovascular diseases, and even certain neurological disorders. Liquid biopsies. These are blood tests that can detect cancer-related DNA before a tumor shows up on imaging. So it's not just innovation, it's implementation.
So much means we are going a long way, even from the young newborns, even before their birth in the pregnant women, to the people who come up for their genetic testing. It's really going on in implementation phases. So while you are doing all these kind of studies, all these kind of diagnostics, although it sounds promising, but there must be some challenges too in this situations.
Absolutely, there are several challenges. The first one is how well the general public is educated about genetics, basic genetics, to understand their results. And if I'll talk about variant interpretation, is not always black and white. Not all genetic findings are actionable. Sometimes we find variants of uncertain significance, and these are the variants which actually cause anxiety to the patient, to the clinicians, as there is no proper closure. Then there is ethical disclosure. Do we tell a patient about a finding unrelated to their primary concern? What if it's a risk they didn't ask to know about? Informed consent is very, very, very crucial. And finally, data privacy. A genome is the most sensitive data a person can share. We need strong safeguards around storage, access, and potential misuse of this information.
So, as I could get for my listeners, it's more of educating people, it's more of a cordial relation between the doctors and the patient, and obviously the privacy of data, which in this scenario of all AIs and everything going on, it's more important to save that personal data. So, these kind of ethics are the one which you wanted to highlight, right?
Definitely.
So what do you see going ahead, say, might be in the next 5 years? Will every hospital be using such kind of genomic data as a part of basic care?
I think so. Moreover, it has already started. We are moving towards integrating genomics into electronic healthcare record. In some countries, newborns are already getting their whole exomes and genome sequenced. But the key will be training clinicians, bridging research with practice. Genomic literacy has to become part of how we treat patients. It's a very, very important thing that every person who is involved in healthcare system dealing with genomics should understand.
This is a very, very important statement which you just mentioned about bridging the research with the practice, because a number of things goes on in the labs. But once it comes to the healthcare segment, once it comes to the use of local people, like the people on grounds, it's the time when you say that okay, now something record breaking is going on. So, what would be your final thought, your one message you want people to have a takeaway from this chat?
I think that your DNA isn't your destiny, but it's a powerful roadmap. And
Definitely.
if used ethically and responsibly, genomics can help us rewrite the story of disease from reaction to prevention.
Well said, Dr. Saima. It's like bringing us to end of this powerful conversation, but how this genomic data is reshaping the way we detect and prevent diseases. As we heard from you today, our DNA holds more than just ancestry. It definitely holds the potential to rewrite the future of healthcare. We thank you so much for joining us. This was truly an enlightening session. Big thanks for sharing such insightful perspectives, and even to our viewers who joined us and had such information from your end, because you are the people who are dealing with this in day-to-day life.
That's much of appreciation for bringing me to this platform. Thank you, Dr. Purnima. It's a pleasure. And definitely what you said and what I said together makes the real story for all the people to understand genetics and genomics, and have full faith that it's a powerful roadmap and we can work along together to fight several diseases.
Definitely. Thank you so much, ma'am. And even to our viewers, thank you for joining us. Stay curious, stay informed, and remember that the future of health is coming to be personal. Until next time, thank you for watching, and let's keep advancing science with quality. Thank you.
Abdos Life Sciences. Advancing science with quality.